Health workers have gone on strike this morning in protest over the government's decision not to pay a recommended 1% wage rise to all NHS employees.
It's thought a total of 400,000 staff will be stopping work for 4 hours. They'll also begin a 4-day work to rule starting tomorrow.
In a moment, we will speak to the Health Secretary, Jeremy Hunt. First, though, let's go to Tim Muffet, who's on the picket line in central London. Morning to you, Tim. And how's it likely to affect things there?
Yes, good morning to you. This is the HQ of the London Ambulance Service. People taking part in the industrial action, as you can see, began at 7 o'clock. Will be going on until 11. Let's have a quick chat to some of those who are taking part. Sir, why have you decided to take industrial action?
Today, well, it's just impossible to live now in London with the wages that we're getting. We're trying to provide the best patient care we can, and we can't even afford the rents at the moment. We haven't had a pay rise in 4 years, and it's proposing that we'll freeze it for another 3. It's just impossible. Okay, so a quick chat to you. Adi, what's your message to people today of this city who might need ambulance care?
Well, we're going to try our best. We're going to do what we can to help people in London. We're not going to leave people suffering, so we will provide life and limb cover. We just hope we just get over the 4 hours and hope everyone stays safe.
What's your message to the Secretary of State for Health today?
We've had enough of this. We deserve more. Public sector workers deserve more than this. We deserve more than this measly 1% that we've shouldn't be getting.
Okay, thanks very much indeed. But as you can see, I'd say there's approximately 50 or so people taking part on the industrial action here. This picket line in London Ambulance Service until the 11 o'clock. This strike will be in effect. For now, back to you.
Thank you.
Well, let's talk now to the Health Secretary, Jeremy Hunt, who is in our central London studio. Mr. Hunt, thanks for joining us. I know you want to talk to us about Ebola, which is very important, but also, so is this strike, to be honest. It's the first health service strike in a generation. Midwives going out for the first time in 132 years. Why won't you talk to the unions?
Well, good morning, Bill. We absolutely will talk to the unions. We've been prepared to talk to them throughout this. And the first thing I want to say is that I recognise that frontline staff do a magnificent job in the NHS. I mean, one example, you mentioned Ebola. We've had more than 650 NHS volunteers who've said they're willing to put themselves in harm's way and go out to West Africa, one of the most dangerous parts of the world right now, to help tackle the Ebola virus at source. So we have magnificent people, and we are offering them all 1%. But the majority of NHS staff get an automatic pay rise through their increments of around 3%. And we're just simply saying we can't afford the 1% on top of the 3%. So we'll make sure that everyone gets the 1%, but we can't give it to people who are already getting, in many cases, a lot more than that.
You say you're prepared to talk to the unions. Dave Prentice, about half an hour ago here on this programme, says you won't talk to them. You won't negotiate.
Well, I had a meeting with Dave Prentice, and I've said consistently that we will talk to them if they're prepared to look at reforming the system of increments, which is incredibly complex and unfair. But the bottom line here is very simple. I've had clear advice, analysis that says that if I accepted the pay review body recommendations, NHS managers in hospitals would lay off around 4,000 nurses next year and around 10,000 nurses the year after. And the NHS has just come through a very difficult period with the tragedy of mid-staffs. And responding to that magnificently, we have now got 5,000 more nurses on our hospital wards in just 1 year. So hospitals are recruiting nurses like crazy at the moment. Right. And this would put that into reverse, and I don't think that would be the right thing for patients.
If your party, though, pledged to spend more money on the NHS as it did at its last conference, why not do that now? As reported in Times this morning, investigations discovered that we're wasting £5 billion unnecessarily in the NHS at the moment. We tightened up procedures. You could pay for everything, couldn't you?
Well, we are cracking down on waste, and we're doing that in a way that's never happened before. We've saved around £6.5 billion in this Parliament by very important reforms, but we have to do that anyway because we're with an ageing population. We're treating nearly 1 million more people every year, 1 million more operations every year than we were just 4 years ago. And that's helping us, for example, get back up the European League table for cancer survival, where we were much too low, and helping us cope with the growth in older people. So there are a lot of pressures on the NHS, but I think the most important thing here is doing the right thing for patients. And I think it would be irresponsible for any health secretary to accept a pay recommendation that would mean that NHS hospitals laid off nurses, and that's what we're faced with here.
Right, let's look at Ebola. Screening calls to the 111 NHS service to ask people who are suffering certain symptoms if they've been to Western Africa. How many people do you think who are actually feeling ill with those symptoms are going to call the NHS phone line like that?
Well, I think it'll be very few, and I'm satisfied on the advice of the Chief Medical Officer that the procedures we have in place already today are correct, given that the risk in the UK remains low. But we have to prepare for the situation getting worse, and in West Africa now the incidence of Ebola is doubling every 3 to 4 weeks. And so I want to make sure we're prepared for the fact that it is now, I think, more likely than not that someone will arrive in the UK with Ebola. And one of the most crucial things in that situation is what happens when they make their first contact with the NHS. So if they dial 111, we need to identify them as higher risk so that we can send the ambulances with the correct protective equipment to them. And that's why I'll be announcing later to Parliament, some very important changes in procedures across the NHS, just to prepare ourselves for the eventuality that things might get worse.
Well, just how much worse do you think? I mean, you must have built some kind of projection on this. How much worse could it get? You say sooner or later someone's going to arrive with Ebola. They may already be here. How many cases would you realistically expect here in Britain?
Well, I will later this morning be receiving from the Chief Medical Officer her estimate of what she thinks the number is that we need to prepare for, and I'll be announcing that number to Parliament. But I think the most important thing of all to say is if we are to protect the population in the UK, that the single most important thing we can do is to tackle this disease at source, which is why the efforts that we're making in Sierra Leone and that the French are making in Guinea and the Americans are making in Liberia are so important. 750 military personnel, NHS doctors and nurses going out there. Because in the end, what we need to do is to contain the virus in West Africa. That's the most critical thing right now, and that's why we're putting a huge amount of effort into that as well.
Right. Doctors working for Public Health England are concerned about plans to screen for Ebola at UK borders. One has said he wasn't confident at all that they would be adequately trained, supported or kept safe, that they don't have the necessary training to do that particular job. Another one's described it as PR-motivated nonsense.
Well, I think there are a lot of misunderstandings, and that's why it's very important that we get the right training in place, put in place the right procedures. The main purpose of the airport screening that we're introducing is not actually to identify people who have Ebola, have the symptoms right now, because most of them would have been prevented from flying by the checks that you have already at the airports in those countries. The main purpose is to identify higher risk people, because the virus incubates for up to 21 days. And we need to make sure that anyone who is higher risk, we know their contact details, we're able to stay in touch with them, monitor their temperature on a daily basis, so that if they do develop the symptoms, we can get to them quickly. And that's better for them. That massively increases their chances of survival, but it's also much safer for the public. And the way you pick up those people is by making sure that you have proper interviews of people who may be higher risk when they arrive in the UK, so that you have those details.
What do you say to the doctors, though, who say we're not adequately trained or protected and we don't feel safe if we're going to do this sort of thing?
Well, I hope when they hear my statement to the House of Commons this afternoon, they will be reassured that we are taking all the measures that we need. This is not an airborne virus. You need an exchange of bodily fluids to catch it, but we need to make sure that everyone gets the training, everyone is reassured about what they need to do to stay safe.
All right. Jeremy Hunt, Health Secretary, thanks very much for your time.
Thank you.
Let's catch up with Carol.